Hello, my name is Ayla. I am the medical assistant here at Pacific Northwest Medical Group, where we specialize in supporting our patients during their weight loss journey. Thank you for joining me today in this video, where I will explain and demonstrate how to self-administer a subcutaneous injection. A subcutaneous injection is an effective way to administer medication to treat medical conditions. Drugs like Semaglutide and Tirzepatide need to be absorbed into the body slowly. That is why administering them with a needle that penetrates the adipose or fatty tissue, which is located just beneath the skin, is used. Preparing and gathering of supplies. Prior to administering any injection, make sure to wash your hands with soap and water. You will also need to gather the necessary supplies. These will include your personal vial of medication, 2 alcohol swabs, a sharps container, and a new insulin syringe. These syringes have the needle attached. Examine your personal vial to ensure that the following statements are true. It is the correct medication and that the box has your name on it. The medication is not cloudy, and there is no visible damage to the vial. The date of your injection is not past the medication's expiration date. Make sure to review your documentation of your previous injections and the dosing schedule. This will help you decide the next correct dose and verify that it has been 7 days since your last injection. Drawing up your dose. First, open an alcohol swab and use it to clean the top of your vial for every injection. Next, you will need to remove the safety from the bottom of the syringe as well as the cap that encases the needle. Noticing that the vial has 2 circles on the rubber stopper, you will use the needle to puncture the innermost circle. Once the needle has been inserted into the vial, you may let go of the syringe. You will then need to turn the vial upside down. Since these syringes contain a small amount of air, we can then pull down on the plunger until you reach about 5 units. This will allow a small amount of medication into the syringe. Following this, you will need to push the medication and most of, if not all of, the air back into the vial. Next, you will pull the plunger down past the line indicating the unit measurement of your dose by about 10 units. Thereafter, you will push the plunger up until the top of the black plunger is lined up with the bottom of the line indicating the number of units you are using to achieve your dose. Once you have a full dose of your medication needed in the syringe and there are no air bubbles, you will pull the vial away from the needle. You may place this syringe on an alcohol swab. Administration of medication. Open the second alcohol swab and start to clean your site of choice. You can accomplish a clean field to work with by starting in the middle of the chosen site and beginning to wipe the swab in a circular or spiral motion. You will start with small circles and then gradually make them larger until you have about a 2-inch field to work with. Be sure to avoid using a site that is within 2 inches of your navel in any direction. It is also best to avoid administering your dose near or on top of any scars, transdermal patches, other injection sites that were previously used for administration of other medications, and lastly, where your waistline sits for the day. Pick up the syringe and give the site a moderate squeeze or pinch prior to inserting the needle all the way straight into the skin. The exception to this is if the chosen site is the back of the arm. Then the needle must be inserted at a 45-degree angle. While the needle is inserted into your skin, you will then push down on the plunger to administer your dose at a moderate pace to avoid discomfort. Once the dose has been fully administered, you will remove the needle by pulling the syringe straight out and letting go of your skin at the same time. Being sure to carry the needle facing down, you will immediately place your used needle into your sharps container after your injection. You may notice at the injection site a slight circular imprint, a red mark, mild pain, and possibly bruising. Although the occurrence of these symptoms is less common, it is still possible, and these instances are considered to be within the range of normality following an injection. If you notice any persisting symptoms at your injection site, such as ongoing or continued pain, redness and or swelling, tenderness and or warmth, please reach out to us, as these symptoms could indicate a potential skin infection. Please remember, if you have any questions or concerns, you are always welcome to reach out to us. Thank you.